Young men kicking around a football, a common sight across the country, just normal life. And that, for these men suffering from psychosis, is just what the Early Intervention Service from Lancashire NHS Foundation Trust is providing them. The opportunity to recover and live a normal life. Dan Johnson is just one of over 700 14 to 35-year-olds using the EIS, which was launched 4 years ago.
We meet up every week. There's usually 10 of us, at least enough for a five-a-side football. I was kind of involved about a year ago, first started coming. I was really apprehensive about even meeting other service users at that stage, and the first few times I only got to touch the ball, but it's like first time you score a goal everyone claps, and then as well as the fitness side, which is really important, it's the good social to kind of meet people and kind of exchange like war stories, if you will, and what treat, just kind of really good to meet other people with similar issues.
And users just like Dan are right at the centre of the integrated approach, which works with the expectation of recovery.
Lancashire Care is a mental health and substance misuse provider of services, but we think it's very important when we're thinking about the health and well-being of the people of Lancashire that we are focused on maintaining their health as much as we are about thinking about treating them when they're ill. All the evidence shows that the earlier that we can support people and provide effective intervention, then the better chance they have of a full recovery, and that actually their chances of relapse and needing some of our other services in later life are much reduced. So that's why it's so important. It's about preventing ill health for the future.
The concept of early intervention is to treat the illness of psychosis as early as possible. To give an example of physical illnesses like an angina, in heart illnesses, in angina, you try and treat patient as soon as the chest pain starts. And you do not wait for an infarction to set in. With early intervention in psychosis, you do not want the whole spectrum of symptoms to come in, but start at as early as possible to reduce the duration of untreated psychosis.
I can hear it, and it makes me anxious, makes me not want to leave the house.
And from the very start through to recovery and beyond, the EIS offers care through a holistic approach. Step 1 is assessing the individual needs of each user to enable a tailor-made service.
First thing that happens is assessment, and that assessment is the foundation for any further work that the Early Intervention Service carries out with the individual.
If you were rating yourself, Alicia, on a scale of 1 to 10...
After the assessment, we start working alongside their care plan that's identifying goals for their recovery. Those goals might be, coping with stress, coping with paranoia, coping with voices. It might be about making lifestyle changes. It could focus on activity scheduling. It would focus also on relapse planning.
These activities could be country walks, the football training, or individual activities with the user's STR worker, all reflecting the biopsychosocial approach which all staff are trained in, such as at this session, which is being held in a community venue, with the added benefit of reducing public stigma of psychosis.
We have kind of a stepped care approach to care within our service, and that essentially means that we try and tailor the approach that we use for a particular individual and where they're up to in the recovery process. And we work very closely with the multidisciplinary team that we've got. Each person brings something unique to that, and together we put together a package that hopefully will meet the needs of that family and that individual. Early intervention has been described as a biopsychosocial approach, and really that means that we value appropriately the contributions of the medics, the social workers, the nurses, the psychologists, the support time and recovery workers, and that we see that everybody plays an important part in helping someone move on the kind of route towards recovery.
This is typical of the Foundation Trust staff focus. The specialist multidisciplinary teams are delivering evidence-based practice and in turn developing their own internationally recognised research. But the real success lies in the difference being made to the individual lives.
It's just the support and kind of the constant support, the constant reassurance I got from the early intervention team in the early days at least, and then there's the therapeutic input whereby you pull your kind of thoughts apart, how true you think you are in a more balanced perspective. So that's kind of what we've gone through as a service user to get to the stage that I am today.